I'm Dr. Kristen Hammett, and today what Allie and I wanted to show you what we do on an everyday general physical exam. This is Beckham, who's going to help us out while we do this. One of the things that we find is that clients many times will come in with a particular problem that they're concerned about, but they're focusing on that issue and not aware of some of the other problems that may be there. On average, most of our patients will have 2 to 3 undiagnosed problems that we need to be aware of that you'll miss if you don't do a full physical exam on every patient. We're going to start with looking at Beckham's nose, making sure that it's equal and symmetrical, no loss of pigment or coloration, and looking for any scabs or discharge. Then I'm going to lift this lip and look in this mouth to check for gum color, presence of tartar on the tooth, inflammation in the gums, any growths on the mouth, and also on the hard palate or tongue. Then I'm going to move to the eyes. They should be bright and clear. I'm looking for any indication of inflammation or problems with these third eyelids or eyelashes. From there, I'll go to the ear. We're going to look down in this ear canal, which is much longer than a human's ear canal, and one of the key problems that we many times will have. I'm looking for the presence of inflammation or infection, discharge, buildup of wax in the canal, and whether that membrane at the end, the eardrum, is intact. From here, I'm going to go to the lymph nodes and check that they're okay. Then we'll look at the back of the eye with the ophthalmoscope to check and see what that retina looks like. Now that we're through with the head, we're going to move on down and check lymph nodes and the limbs. Go back to the back part of the body, do the same on the rear. Check the abdomen, listen to the chest, and complete our physical exam. So here, I'm going to check lymph nodes that live here, armpits, groin. While I'm back here, I'm also taking a pulse. I can feel the pulse on the inside of both hands. Lymph nodes back here, all okay. Take each foot, feel each toe, up the joints. Ooh, that popped, Beckham. But there's no pain or inflammation in any of those. We'll move on back to a hind leg and do something similar here. Just checking all these joints out for any sensitivity or problems with rotating or moving the joints, any popping or creaking. And then I'll compare one leg to the other to make sure that they're even and equal in muscle. If not, that may mean that he's favoring one more than the other for some reason. I need to check more closely. Now I've moved to the abdomen and I'm feeling the internal organs. I can many times pick out the spleen and the bladder and the liver, as well as some of the intestines, just by feeling in a relaxed dog. From here, I'm going to move on to listening to these heart and lungs. So I typically will start on the left side, which is where the heart's closest. And as I move my stethoscope around, I'm hearing different valves of the heart, checking for murmurs, irregularity in rhythm or rate. Then I'll go to the right side, checking the one that I can hear best on the right. And then move for listening to the lungs and take a couple of breaths on either side so I can hear if there's any fluid or harshness in the lungs. From there, we're through with a lot of this, and I'm going to check the back end and his coat, looking for fleas or ticks or scale or in signs of infection or inflammation. Many times my assistant, Allie, while I'm doing my exam, she's feeling of him as well, and many times she'll pick up lumps and bumps, sometimes before I even get to them. We're now through with our general physical exam. Beckham's been a very good patient for us. Any areas of concern that we would have found at this point, we'd go back to and direct more full attention to, as well as the primary concern that the owner brought our patient in for us today. I appreciate your time in watching this. Any concerns that you may have, that you may find with your pet, always take those to your veterinarian. They're the best professional to be able to give you good advice.